Good morning po to our media partners and welcome to the DOH Beat COVID-19 Media Forum for July 20. So today we will be joining by our Undersecretary Maria Rosette Vergere, also our DOH spokesperson, to give us the latest updates on our COVID-19 response and other public health services. Good morning po, Yusek.
Good morning, Lindsay, at magandang umaga po sa inyong lahat, sa ating mga media partners, and of course sa ating mga nanonood sa ating YouTube channel. Happy Eid al-Adha sa ating mga kababayan na Muslim. Welcome po to our DOH Media Forum today. It's July 20. Noong nakaraang Biyernes po, inanunsyo ng Kagawaran ng Kalusugan kasama ng University of the Philippines Philippine Genome Center at University of the Philippines National Institutes of Health ang pagkakatukoy ng local cases ng Delta variant. Bagamat meron na pong mga local na kaso, hindi pa rin po tapos ang laban dito. The race is still on against the variant. Binibigyan po natin ng kahalagahan ng ating border control measures, enhanced implementation of our prevent, detect, isolate, treat and reintegrate strategies, at walang humpay na pagsunod sa minimum public health strategies ang ating pagsuporta sa ating COVID-19 vaccination program upang tuluyang mapigilan ang pagkalat ng variant na ito sa ating bansa at mapaghandaan po natin ang maaaring maging epekto nito. Now more than ever, we need a national government-enabled, local government-led, and people-centered response. Nitong nakaraang linggo po ay nakita natin ang pagdating ng dagdag na bakuna sa ating bansa. Dumating na po ang mga karagdagang doses ng Sinovac, AstraZeneca at Moderna. Dumagdag din po sa ating vaccine portfolio ang 3.2 million doses na single dose na J&J vaccine sa ating bansa. Makakatulong po ito upang madagdagan ang mga fully vaccinated dito sa ating bansa. Taus-puso po kami nagpapasalamat sa ating mga partners, donors at funding agencies para sa mga karagdagang bakuna na ito. Kamakailan lang din po ay naiulat ang pagtaas ng vaccine confidence sa ating bansa. Nais po namin kunin ang pagkakataong ito upang pataasin natin ng husto ang bilang ng mga nababakunahan. Ayon sa ulat ng vaccine cluster, umabot na po tayo sa more than 15 million doses na na-administer na bakuna. Higit na po sa 10 milyon ang paunang dose at nasa 4.7 million na po ang nakatanggap ng kanilang second doses. Kailangan po nating pataasin upang mas marami pa po ang maproprotektahan laban sa COVID-19. Hinihikayat po natin ang lahat ng priority groups, lalong-lalo na po ang ating senior citizens and those with comorbidities, na tayo po ay magpabakuna na para tayo ay maproteksyonan, no? Especially that there are these variants already in the country. Ang bakuna po ay isa sa pinakaligtas na paraan para makagawa tayo ng proteksyon sa ating katawan laban sa COVID-19. Over to you, Lindsay.
Thank you po, Yusek. I will now be going through the questions po sent by our media partners. From Caroline Bongkin, are our border protocols really enough? How come nakalusot po yung Delta cases?
Caroline, hindi lang tayo i-implement ng isang strategy para mapigilan natin ang pagpasok ng sakit dito sa ating bansa. Katulad ng pinapaulit-ulit natin na 4-door strategy natin, una lang ang border control at meron pa tayo mga ibang doors na pwedeng buksan para tayo ay magkaroon ng mas maigting na pagpapatupad nitong ating prevention of entry of these variants or sakit dito sa country natin. So yung 4-door policy natin, unang-una, naandyan yung border control. Pero kailangan, pagkatapos ng border control, meron din tayong point of entry na mga measures. And this would be our border protocols kung saan meron tayong quarantine, isolation, and testing na sinasagawa. Aside from that, kailangan ready din tayo kapag nandun na tayo sa door 3. And this is what we are doing right now. Yung door 3 natin, ito yung point of care. So kailangan intensive ang pagpapatupad nitong prevention, detection, isolation, treatment, and reintegration. And the door 4 will be our health system's capacity. Kailangan handa tayo for any surge in cases and our health system should be in place. Kumbaga, kaya naghahanda tayo. So pag tinignan natin sa kabuuan, ang ating mga pinapatupad na mga measures or protocols, it is done comprehensively. It is not just to do border control, but also to intensify the other protocols that we have. So currently, yung border control natin, nagre-restrict tayo sa mga ilang bansa across the globe para hindi mas makapasok ang Delta variant dito. Pero kailangan yung mga iba pa nating measures ginagawa ng maayos. At nakita naman natin yung ating door 2, yung ating pag-isolate, quarantine, and testing sa ating borders ay nagiging effective because we are being able to assess or identify itong mga variants from the ROFs na pumapasok dito sa ating bansa. So kung meron mang breaches, titignan natin yan at para makapag-improve tayo. We're not saying 100% effective lahat ng ginagawa natin, pero as much as possible, we like to ensure na natutupad ng maayos at napapatupad ng maayos ng lahat ng ports of entry ang ating mga protocols.
Thank you, ma'am. Also from Caroline, ilan ang OFW na dumating sa bansa ang nag-positive sa COVID-19 since January at ilan na po sa kanila ang napasailalim sa genome sequencing?
Caroline, since January, we have a total of 7,246 arriving, returning overseas Filipinos or OFWs who have tested positive for COVID-19. Out of these 7,246, 650 of them have undergone genome sequencing. So you might ask, bakit 650 lang? So minsan nagpa-prioritize tayo, no? We do sampling and minsan hindi talaga nagka-qualify yung kanilang specimens dun sa paggawa ng ng whole genome sequencing. So either yung CT value ay mataas o di kaya yung specimen na collected ay kakaunti.
Thank you po, ma'am. From Marites Ilano, has DOH traced the sources of infection of the Delta variant cases? As Dr. Saloma said, the virus is 100% from abroad. Have you identified the specific routes that could have allowed infected travelers to enter the country?
Well, sure, we are trying to investigate that right now, no? So kailangan natin antayin yung sapat na ebidensya. We cannot assume at this point. But what we can do is to assume na nakapasok, what we can say is, ang assumption talaga is galing talaga sa labas. Hindi naman po dito tayo nagkaroon ng mutation at makakapagsabing dito na rin kumalat sa ating bansa. That is out of the analysis that we are doing right now. So definitely ang assumption namin, it really came from abroad. Now as to the origin at kung saan yung source of infection, that is what we are trying to find out right now. Kaya we are doing intensive contact tracing at pagkatapos niyan, ginagawa rin ng Philippine Genome Center yung analysis dun sa phylogenetic tree. Dito sa analysis na ginagawa nila, makikita natin how related these cases are and ano yung mga lineages na pare-pareho po itong mga pumasok dito sa ating bansa so that we can identify really the source of this infection.
Thank you, Yusek. We have several reporters po who asked about updates on the contact tracing from Marites, Caroline, Jessel, JC, Sheila, and Lay po. Ano na daw po yung updates natin sa contact tracing ng mga Delta cases po natin?
So as of July 19, 9 p.m., nakapag-sumite sa atin ng mga iba't ibang regional offices natin as to the status of backtracing and contact tracing na sinasagawa ngayon ng ating local governments. So they gave us a total of 91 contacts traced for these 16 recent Delta cases identified. So sa NCR, ang naisubmit sa amin ay 8. Pero alam natin kahapon that Mayor Isko has mentioned that they were able to trace about 36 individuals. So inaantay pa rin po natin yung kanilang submission for the complete report, no, na itong sinabi nila. For Region 6, they were able to trace 10. For Region 10, they were able to trace 27. And for the returning overseas Filipinos, we were able to trace about 46. So hindi pa ho tapos ang backtracing natin, pinagpapatuloy pa rin natin para makita natin lahat ng taong nakasalamuhan itong mga individuals na to. We will be giving information in the coming days again regarding updates on contact tracing.
Thank you, Yusek. From Greg and Lay, may updates daw po ba tayo sa COVID-19 situations in the high-risk cities? And kumusta na raw po ang sitwasyon sa Metro Manila? May mga reports na tumataas ang mga kaso at pahirapan na raw po ulit ang referral sa mga hospitals.
Sa ngayon, ang ating mga kino-consider, no, na high risk na areas ay pareho pa rin po ang Region 11, ang Region 6 at saka yung CAR, yung Cordillera po. Yung kanilang risk classification po ay nasa high risk sa ngayon. Ang Region 11 po mataas pa rin ang kanilang intensive care utilization rate. Ang Region 12 and Region 9 high risk ang ICUR, yung intensive care. Ang Region 11 ay critical risk. Ang National Capital Region po ngayon ay makikitaan natin na nandun pa rin dun tayo sa low risk, but it is not something that to be complacent of. Especially nakakakita na ho tayo ng konting pagtaas sa mga kaso sa ilang lugar dito sa ating National Capital Region. Nakakakita rin po tayo ng ibang mga cities here in the National Capital Region na medyo nagkakaroon na ng pagdami ang pag-admit ng mga tao or mga COVID cases or suspects and probable in their hospitals. So again, even though the classification is at low risk because of the general and HCUR across all cities, pag tinignan natin sa bawat city, meron na po tayong na-observe na konting pagtaas ng number of cases. And also, we are observing also in the hospitals na merong konti ng pagdami nito mga pumupunta sa ospital because of COVID-related symptoms.
Thank you, Yusek. Also from Lay po ulit. Last week, San Juan City Mayor Zamora claimed there is a discrepancy between DOH data and LGU's data, particularly on the number of active cases. Have we clarified this?
Yes, no? So we always clarify this, Lay, at alam po natin yung mga different time cut-offs sa differences ng national, local, at saka regional data. Alam po natin, simulat sa poll, na ipapaliwanag natin na ang ating cut-off every day would be 11:59 p.m. every day. So pag inantay natin yung kanilang ipinapasok dito sa ating mga sistema, pagdating ng 11:59, cut-off na kami. So maaari na meron tayong difference kapag gano'n with the local government and the regional office. That's first. Second, there is this process of validation. So ang mga local governments, before they really say at ipapakita dun sa kanilang dashboards or sa kanilang system na sa kanila yon, they need to validate. Gusto nila, nakikita nila na talagang residente nila yon at talagang verified yung status. So sometimes nakakauna kami at mas madami yun sa amin at yung sa kanila ay mas kakaunti. Ngunit minsan naman mas madami yun sa kanila dahil na-verify na nila, na-validate na nila agad-agad because they are the ones on the ground at yung sa amin, bina-validate pa lang. So these are the causes of discrepancies at ito po ang isang bagay na pinagtatrabahuhan natin with our local governments from the very start para lang at least ma-minimize natin yung gaps natin with the differences between the national and the local data.
Thank you po, Yusek. From Lay and from Ian Cruz. Yusek, ano na daw po ang gagawin dun sa mga bakuna sa isang vaccination site sa Muntinlupa kung saan pumalya daw po yung cold storage facility?
Well, yes, no. Actually, according to Yusek Mir na nga, base sa kanilang initial na pag-aaral, talagang nagkaroon ng parang failure, no, dun sa pag-store dahil yung sinasabi nga na yung mga bakuna nakalagay doon nagkaroon ng problema ang cold storage and yung kanilang system or proseso na pag-check ay hindi nila nasa ayos. So ngayon, ang ginawa natin sa central office, because we would want to verify really and determine kung magagamit pa o hindi ang mga bakunang to. So we have submitted these samples o these vaccines to the UNICEF. Sila yung may mga eksperto para i-check kung talagang magagamit pa ang bakuna or hindi. So antayin po natin yung report ng UNICEF. DOH is closely coordinating with them so that we may be able to know kung pwede pang gamitin o hindi na ang bakuna.
Thank you, Yusek. From Cristel and Caroline, regarding po sa machines for genome sequencing, have we planned to procure more of this during the emergence of COVID-19 variants? Or ngayon lang po natin nakita yung importance and necessity nito? So, ano daw pong plans natin, Yusek, for procurement? Or do we plan to buy more machines for genome sequencing to increase our capacity?
Cristel, hindi naman ngayon lang nakita yung importance, no? So we had been doing the whole genome sequencing ever since that the UK variant became a threat across the globe. So last December, nalaman natin na may UK variant at paumpisan ng January, tayo ay nakapagplano na on how we are going to do whole genome sequencing. Our University of the Philippines National Institutes for Health at saka ang UP Philippine Genome Center has long invested on these machines already. Actually, ngayon, meron tayong 5 malalaking makina dito sa Philippine Genome Center that can do this whole genome sequencing. Aside from that, we have smaller machines with capacities of 45 at yung iba pa mas maliit dyan na makakagawa naman yan ng mga urgent na sequencing na process na kailangan natin dito sa ating bansa. Pero hindi lang naman po makina ang kailangan para makapagsagawa tayo ng whole genome sequencing. Kailangan po natin ng tauhan na very skilled, highly skilled po ang mga taong gumagawa dyan sa WGS natin or whole genome sequencing process. Kailangan po natin ng additional na reagents, kailangan po natin ng extraction machines, kailangan po natin ng mas madami na resources so that we can be able to do this and increase our capacity. At isa na po yan sa mga plano natin sa ngayon. So for us to be able to double our output of 750 samples per run, tayo po ay nakikipagtulungan na ngayon sa Philippine Genome Center so that the extraction machines can be provided to them. This can double our current capacity and we can have an output of at least 1,500 samples per week kung magagawa na po natin ito. Aside from that, we have already secured reagents until the end of the year with the funds that DOH has provided to the Philippine Genome Center. Pangatlo, meron ho tayong plano for the expansion of our whole genome sequencing process to strategic areas in the country. And this, we will use the UP network. So we have the UP Visayas and the UP Mindanao, wherein we are trying to capacitate right now na andyan na yung mga forward plans natin para makapagbigay ng kapasidad. And hopefully, bago matapos po ang taon ay maaari na po tayo makapag-expand ng ating whole genome sequencing dito sa mga lugar na ito.
Thank you po, Yusek. I think that answers already yung question din po ni Lay Alvis regarding plans to further strengthen our genome sequencing. Also from Lay and from Karen Yusek, may we ask for updates on the tugboat and barge carrying COVID-positive crew members about to dock in Albay? May action na po ba ang DOH dito and paano po ang contact tracing sa nakababang Pinoy sa Butuan?
Yes, no? So actually, nung bago pa lang dumating ito, vessel na ito ay nabigyan na tayo ng information. So we were able to plan ahead, nakapag-usap na yung regional offices natin kung ano ang gagawin natin, coordinated with the different agencies also like DOTR, ang ating BOQ at iba pang ahensya para kasama sila sa paghahanda. So dumating na po kaninang maaga, ito pong vessel na ito doon po sa shores ng Albay. Naandun na po sila, regional office have given us that report already na they are now isolated in their vessel. Pinabantayan po sila ngayon ng Philippine Coast Guard, walang magdi-disembark, walang papasok sa vessel kung hindi po sila yung essential na kailangan natin para mag-monitor sa ating mga crew members dyan sa loob ng vessel na yan. Yun pong vessel na yan, meron po silang 20 na crew, galing po sila sa Indonesia. Ito pong 20 ito, nung tinest po sila doon sa port, doon po sa Butuan, sila po ay nagkaroon ng positive cases na 12. So yung 12 po, they were advised and they were given clearance to travel and to go to dun sa Albay, no? Para dun po sila mag-dock. At kasamaang palad, may isa po na nakalabas ng vessel at umuwi dun sa kanilang lugar. So sa ngayon po, yung isang nakalabas, according to our regional office, they were already able to locate at once. He is now isolated. And yun pong kanyang close contacts, yung kasama yung driver ng public transport, yun pong isang helper, at saka lahat po ng kanyang kapamilya ay na-quarantine na po ng local government natin. So tayo po ay mag-aantay ng further details doon po sa iba pang mga naging contact nitong isang taong nakalabas ng vessel nila at umuwi sa kanilang lugar. You'll give information in the coming days. As to the 11 individuals inside the vessel, sila po ay closely monitored ng ating regional office at Bureau of Quarantine and Philippine Coast Guard. Diyan po sa lugar na yan. If ever somebody of them will turn symptomatic, sila po ay agad-agad na dadalhin doon sa isang ospital na malapit doon po sa pinagka-dock nila o kung saan sila po nakalagi ngayon.
Thank you po, Yusek. Regarding po dun sa vaccination status ng isang death po na na-record natin sa Manila, na-vaccinate na daw po ba siya? Or if yes, ilang dose at kailan po ang last dose?
Yes, out of the 35 cases, as I've said yesterday, 3 po ang meron na tayong deaths, no, dito sa Delta cases dito sa ating bansa. Yung isa pong death, 63-year-old male, is a returning overseas Filipino at siya po ay kasama dun sa MB Athens. Yun pong kanyang vaccination status we are still verifying. But as to these 2 recent cases, itong 78-year-old female from Antique and 58-year-old female from the city of Manila, both are not vaccinated upon verification.
Thank you po, Yusek. From JP Soriano, sa UAE nabigyan na ng booster shot na Pfizer ang ilang OFWs na nakakumpleto na ng second dose ng COVID-19 vaccine. Sa Pilipinas, may ginagawa po bang pag-aaral ang ating mga eksperto mula sa DOH para sa oras na may sapat na bakuna ay makapag-administer na rin po ng booster shot ang Pilipinas?
Yes, JP, meron tayong sinasagawa na study ngayon. Ito po ay funded by the Department of Science and Technology, and this is about a study evaluating the safety and immunogenicity of mixing different COVID-19 vaccine and vaccine platforms among Filipino people. Kasama po dito yung sa booster doses. Ito po ay isasagawa ng Philippine Society for Allergy, Asthma, and Immunology. This is going to be for 18 months. No? So ito pong study na ito, meron hong 3 grupo ng mga individuals na bibigyan ng mga bakuna. And ang protocol will be, Group A will have the same type of vaccines. Group B, vaccines can be interchanged. And Group C, pag-aaralan po yung mga high-risk groups natin that can be given booster doses. So ito po ay aantayin natin, pero hindi naman sinabi na hindi tayo pwedeng gumamit ng mga ebidensya galing sa ibang bansa na nagpapatupad nito. Pero katulad po ng lagi naming sinasabi, according to our experts, the vaccine expert panel and the all experts panel of DOH, hindi pa ho natin nire-recommenda ngayon ang booster doses because there is still incomplete evidence. Ang sabi rin nila sa amin, kung sakasakaling tayo ay magdedesisyon na magkaroon ng booster doses, maybe it's going to take months pa before we can recommend. First, because of the insufficiency in evidence, and then the second would be, we like to consider equity at this point kasi marami pa rin pong mga kababayan natin ang hindi nababakunahan. At pag inumpisahan po natin itong booster dosing, baka hindi po magkaroon ng iba nating kababayan ng bakunang kailangan din po naman nila.
Thank you po, Yusek. Yusek, baka we can clarify po regarding yung mga active cases po ng Delta variants. Kasama daw po ba sila dun sa 35 initially classified as recovered or as additional cases po?
Yes, I'd just like to clarify. I think people got confused with my answer sa CNN this morning. So ang sabi natin, meron tayong 35 cases, no? And of these 35 cases, we have 16 recent cases. Doon sa 16 na recent cases, we have 11 cases na local at 5 cases na returning overseas Filipinos. At the outset, ito pong ating mga kaso na recent na 16, sinabi natin may 2 namatay, so may 14 pa na aktibo. That would be 9 na recovered, I'm sorry. So 14, 5 ROFs, 9 na local cases. At the outset, sinabi, recovered sila based on the reports of our local government units. So kasi nga sila ay nakakumpleto na ng kanilang pag-isolate, ng kanilang pagka-quarantine, na 14 na araw, wala ng simptomas, so they were tagged as recovered. So ang ating protocol, kapag nagkakaroon ng variants, no, na-determine ang isang tao na may variant, binabalikan po sila ng ating epidemiology and surveillance units so that we can assess them and we need to retest them. So kina-quarantine po sila uli, and then until they have negative results, saka po sila ipapauwi. Nung nag-retest po tayo among these local cases and returning overseas Filipinos, we found na meron pa rin pong positive sa kanila. And these were the 7 that I just identified kanina po nung in-interview ako sa CNN. Now, I like to clarify, 8 na po ang nakitaan ng positive pa rin sila dito po. Positive po sila sa RT-PCR. And let me give you a rundown. Okay? So ito pong 8, isa po yung taga City of Manila. Ang taga Cagayan de Oro po ay 4, isa pong taga Misamis Oriental, at saka 2 returning overseas Filipinos. So we gives us a total of 8 individuals who turned positive with retesting nung binalikan natin sila. Lahat po sila ay walang simptomas. Sila po ay minomonitor sa ngayon at kailangan po makakompleto ng 14 na araw uli na isolation because they have positive results.
Thank you po, Yusek. Yusek, I will now be going through the questions po through our Viber chat. From Aiko Miguel po, Yusek, ilang araw daw po bago ilalabas ang results ng genome sequenced samples? Lahat po ba ng na-close contact ng local case ng Delta variant na trace agad lahat? Up to what degree? Sila po ba ni-require na i-genome sequence bukod sa swab test?
Sila lahat ay ginagawa ang backtracing sa ngayon, Aiko. No? We're doing contact tracing. Ang instruction, do until the 3rd generation contact. So hindi pa ho tapos ang contact tracing efforts. Ito pong mga binigay namin sa inyong numero ngayon are just initial submissions. Tuloy-tuloy pa rin po yung ginagawang contact tracing. As to if they will be subjected to whole genome sequencing, yes, we will do sampling among these close contacts. But unfortunately, doon po katulad nung isang sinabi ni Mayor Isko kahapon na natagpuan nila na positive, no, na close contact sa City of Manila, the city value was high already at hindi na po natin pwedeng ma-qualify yan for whole genome sequencing. As to the number of days when the results are out, ang atin pong proseso with our big machine, it will take us about 5 to 7 days before we can issue out the result.
Thank you po, Yusek. From Maki Pulido, how is DOH preparing for the O2 tanks and ventilators with the threat of a Delta variant surge?
Yes, Maki, no? So tayo po katulad ng sinasabi natin, since nung pumutok po ang Delta variant cases sa India, we started doing our preparations already. So we coordinated with the Department of Trade and Industry. The DTI was also able to coordinate or work with the manufacturers of this oxygen in the country. At nakita natin, minapa kung ilan ang pinoproduce nitong mga oxygen suppliers natin in the country or manufacturers. So sa ngayon po, based on inventories, we did inventories also across the different hospitals of the country, kung saan nakita natin lahat po sila sufficient ang kanilang existing na supplies for oxygen. But we would like to anticipate because in other countries, it took them twice as much as the current as their current needs for oxygen na kinakailangan nila because of the surge that they've had. So ngayon, nakikipagtrabaho tayo sa manufacturers and suppliers para po tayo ay magkaroon ng mas mataas na level ng supplies ng oxygen, magsa-stockpile na po sa ngayon. As to the mechanical ventilators, meron po tayo mga ventilators na bago na procure at yung iba donation. Ito po ay pinapakalap natin sa mga ospital ngayon na mas nangangailangan itong mga makina na ito. Aside from that, we have high flow nasal cannula na ginagamit din po for severe COVID at ito po rin ay nagpe-preposition tayo ngayon sa ating mga ospital as well as oxygen concentrators at iba pang mga supplies ng ospital na kakailanganin kapag tataas po ang mga kaso.
Thank you po, Yusek. From Sheila, ilang percent lang ng positive cases ang nasi-sequence and ano ang ideal sequence rate to get the real picture of variants, especially yung Delta po in the country? And paano daw po pinaprioritize ang samples ng positive ROFs? Based on the numbers provided, wala pa pong 10% ang nasi-sequence natin.
Yes, Sheila, no? Wala talagang 10% pa. Sa ngayon po, it's almost 1% pa lang ang ating nasi-sequence. When we do sequencing, we measure it against the total number of positive samples and not the population. So wala po talagang thresholds na sinasabi na ideal across the globe. Iba-iba po ang pagpapatupad ng whole genome sequencing sa iba't ibang bansa. But there was this one statement of WHO before where they were saying at least 5% of the total positive sample should be sequenced. at hindi pa ho natin yan na-attain. So ngayon, paano tayo nagpa-prioritize? Kailangan po natin maintindihan that because of this capacity of current capacity of our whole genome sequencing, we do prioritization. So we do purposive sampling kung saan meron ho tayong mga priorities na samples na kailangan kolektahin. And our determination for this would be first, yun pong nakakakita tayo dun sa areas na yun na pagtaas ng kaso. Unusually, minsan, kailangan namin malaman kung ano yung rason kung bakit tumataas. For example, in certain areas of the country, these past weeks, nakikita natin yung patuloy na pagtaas ng kaso. No? Lalo na po sa Region 6, nakakita tayo ng areas na ganyan. So ang ginawa po natin, nag-purposive sampling tayo doon para malaman natin what is driving this continuing increase in the number of cases. And we were able to detect variants in this area. So isa po yan. Pangalawa, pag nakakakita po tayo ng mga ospital na nagre-report sa atin that there are more severe types of infection o longer hospitalization, no? O yung days of hospitalization, nagsi-sequence po tayo dyan para malaman natin would this be part of the characteristics of the current variants of concern. So pangatlo po, kasama po dun sa lagi natin, yung mga epicenters po, yung mga centers of infection natin dito sa areas, lagi po yan kasama sa pagsasample. And then the fourth would be our returning overseas Filipinos. Sila po yung talagang mas madami tayong kinukuhang samples. Dahil alam natin na maaring sila po ay makapagdala din itong variants of concern coming from a country outside of the Philippines.
Thank you po, Yusek. From Caroline Bongkin, suggestion po ni Dr. Solante na ibalik yung 14-day mandatory quarantine, strictly no home quarantine, para mas mapigilan, makalusot ang Delta variant sa bansa. Is this on the table na po or nire-reconsider po ba natin na ibalik itong ganitong protocol?
Well, katulad ng sabi natin, so for now, ang gagawin natin, wala tayong pagbabago sa ngayon ng ating mga protocols. These are general protocols actually. What we need to do is to intensify. We need to intensify all of the efforts that we are doing right now. Yun pong 14 days quarantine na yan, ginagawa pa rin naman po natin yan. Kaya lang, yun pong ginagawa natin ngayon, 10 days plus 4. No? So yung 10 days sa national facility, 4 days sa bahay, o kaya kung ang LGU ay may facility naman para paglagakan sila, yun po ang ginagawa natin. These are for incoming travelers. Now, as to our community, where we do isolation and quarantine also, the 14 days is still there. No? Kapag ikaw ay positibo o di kaya ay ikaw close contact na wala kayong simptomas, you stay 14 days in quarantine. Kapag ikaw ay may simptomas o di kaya ikaw ay positibo at may simptomas, you stay 10 days. Kapag ikaw ay wala ng simptomas at ikaw ay nakatapos ng 10 araw, ikaw ay babantayan na lang ng 4 na araw dun sa bahay. So sa ngayon po, ang ating mga local governments, sila po ay nagbibigay na rin ng kanilang mga rekomendasyon na sinasabi nila, for now, we do not want home quarantine also. Mas maayos na nasa facility ang ating mga binabantayan. So I guess that's part of our protocols already na hindi naman po namin kahit kailan in-encourage ang home quarantine, maliban na lang kung walang capacity na ang ating local government at masisiguro na may sariling palikuran, may sariling kwarto at hindi makikisalamuha ang ating mga kababayang home quarantine. So yes, we agree with that. Home quarantine is not encouraged at this point. We should do facility quarantine so that we can better isolate the patient and prevent further infection in the community.
Thank you po, Yusek. From JC Cosico, sabi daw po ng PHAPI, kaya naman daw po nilang magdagdag ng bed capacity in preparation for a surge, pero mawawalan din daw ito ng saysay, especially if kulang po ng mga hospital staff, lalo na ang mga nurses. Paano po matutulungan ng DOH ang mga private hospital pagdating sa pagdadagdag ng mga healthcare workers? Do we plan to hire more healthcare personnel po to prepare for a surge?
Oh, well, actually, nung nagkaroon tayo ng detection ng COVID-19 variant, no, itong Delta variant, nagkaroon ng PhilHealth Board meeting si Secretary Duque as chair at nirekomenda niya ito sa PhilHealth na i-prioritize natin na bayaran itong mga lugar na merong nakikitang pagtaas ng kaso. Bayaran ng mga ospital agad-agad para magkaroon sila ng pondo so that they can expand their capacity, including hire additional health human resources. So kahapon po, napag-alaman natin dun sa Region 6 Town Hall nga na ginawa namin na ang ating palang PhilHealth Regional Office doon sa Region 6 ay nakikipag-usap na sa kanila para ayusin na po ang pagbabayad ng PhilHealth sa ating mga ospital. So hopefully, magtuloy-tuloy po ito, mabayaran po yung ating mga ospital so that they can have extra funds for them to be able to expand more on their capacity, add beds, and of course, most importantly, help human resources. Aside from the PhilHealth funds, ang DOH po ay continuous ang ating emergency hiring at tayo po ay nagbibigay ng pera sa ating mga regional office and hospital so that they can do their augmentation of their healthcare workers. Actually, dito po sa NCR, we were already able to hire additional almost 3,000 healthcare workers at yun pong na-hire na namin over versus dun sa approved slots na meron tayo, almost 60% na po. So tuloy-tuloy po yan and that's part of our preparations at nandito po kami para tulungan hindi lang ang public sector pati po ang private sector if in case may mga kailangan tayo to prepare for this possible kung sakasakaling tumaas sa mga kaso natin.
Thank you, Yusek. Yusek, follow-up question po from Maki. If you have the data right now po, how many oxygen tanks are we stockpiling? Ilan po ang mechanical ventilators? And kamusta po ang stocks sa hospitals in the provinces?
Yes, Maki, no, it's in a table. If you may allow us, we will just be posting in our Viber group itong oxygen supplies natin. As to the DOH hospitals, when it comes to oxygen supplies, we had a separate inventory with them. And accordingly, sila po lahat ay may sufficient supplies for now. But as I've said, kailangan po natin ng twice as much as what we have right now so that we are better prepared. Kaya po nakikipag-usap tayo sa mga suppliers and manufacturers as of this time. We will be posting this inventory that we have in our Viber group for your reference po.
Thank you po, Yusek. Another question po from Sheila Crisostomo, isi-sequence daw po ba natin yung mga crew ng ship?
Yes, definitely. Actually, parang 5 ang naipadala na natin sa Philippine Genome Center. So hopefully we can get the results at once so that we'll be able to determine kung meron tayong Delta variant.
Last question po from Caroline Yusek. Yung isa daw po bang sakay ng barko na nakatakas or nakalabas po, ito po ba ay yung may COVID?
Yes, 12 was identified with COVID-19 through RT-PCR. 11 po yung nakasama ng vessel papuntang Albay. Yung isa po ay bumaba without the knowledge of the captain apparently at sumakay sa isang public transport. So ito po ay napag-alaman naman agad dahil nai-report agad sa mga kinauukulan. Sila po ay nakuha nila agad itong kasong sumakay sa public transport and also those close contacts na kasakay sa public transport at pati na rin po yung pamilya nitong bumaba ng vessel. Yun po, kukuha tayo ng further information later on para we can continuously update you. But for now, that's our information.
Thank you po, Yusek. Yusek, may mga clarification lang po from JC Cosico. He just wants to clarify, 8 tested positive again. Bakit daw po positive ulit? And from Bonds po, just want to make sure that it doesn't mean that they are contagious pa rin po, right? Since they completed the 14 days of isolation, or different po ba ito since Delta variant? So yun, Yusek, they're just clarifying po if yung 8 cases ay, do we still call them active cases or nag-positive lang po ba sila due to the remnant of the virus?
It will all be different among all of them. But because they have tested positive, on retesting, yun po yung classification. Kasi ang classification lang naman natin ngayon ay active, died, recovered. No? So dun po sila napapasok. But when we look at closely these cases, lahat po sila halos yung CT values nila matataas. Ibig sabihin, mababa na yung viral load sa katawan and therefore most likely hindi na sila ganun ka-infectious. But of course, we would still like to be very sure. That's why they are now in quarantine pa rin po at binabantayan po natin sila. Yung iba po dito, completing isolation pa lang, no? So ni-retest lang natin sila, they are currently in the isolation facilities. Yung iba naman nakatapos na po sila at binalikan lang po natin sila para i-retest. And they remain to be asymptomatic. but their their RT-PCR was positive, so we needed to quarantine them again or isolate them again, and we will closely monitor them. So yun pong analysis kung paano, kung bakit positive pa rin, that will come in the coming days. No? Pag-aaralan po namin lahat ng kaso na ito.
Thank you po, Yusek. Yusek, last na po talaga mga follow-up questions and clarifications from Lay. If we could reiterate lang daw po ulit, yung sa positive returning positive ROFs natin, paano daw po ulit natin pinaprioritize for genome sequencing? And may ideal na capacity po ba na genome sequencing para makagawa efficiently ang DOH sa fight versus the Delta variant?
Well, katulad ng sabi natin kanina, Lay, di ba? Walang specific na target or threshold or ideal na across the globe. Iba-iba po ang pagpapatupad ng whole genome sequencing. Yung iba, mas mataas at mas malawak ang kanilang ginagawang whole genome sequencing, like in UK, no? So very matured yung system nila for that. Yung iba naman, mas konti pa sa atin. Dito po sa ASEAN, tayo na po yata ang pinakamataas or pinaka-efficient in doing whole genome sequencing among ASEAN countries. So dito po sa atin, meron tayong capacity na 750 runs per week. Ito po yung samples na pwede nating makuha. So we prioritize returning overseas Filipinos depending on the quality of their specimens. So lahat naman po yung mga magpa-positive sa mga returning overseas Filipinos, ipinapadala yan sa Philippine Genome Center. Now, it will depend on the quality of the specimens. Kung ang CT value mataas, hindi na po pwedeng makasama sa whole genome sequencing. But if the CT value is acceptable and the specimen is of quality, na isasama po yan sa runs natin. Kaya most often than not, returning overseas Filipinos talaga nadidetect natin sila because they are of priority.
Thank you very much po, Yusek. Before we officially end our media forum, do you have any final messages po to our media partners?
Yes, thank you, Lindsay. At gusto lang ho natin magpasalamat sa ating mga media partners. Alam po namin na katulong namin kayo sa pagpapakalap ng tamang impormasyon sa ating mga kababayan. Sa pagtatapos ng ating makabuluhang media forum, nais po namin muling magpasalamat sa inyo na walang sawang sumusuporta sa ating mga virtual conferences. Kahit holiday ngayon, kayo po ay nandito. Maraming salamat po. Sa pag-detect natin ngayon ng Delta variant sa ating bansa, iwasan po natin ang pagiging kampante at sikapin po natin sa ating makakaya na mapababa po natin ang transmission at contact rate ng virus na ito sa pamamagitan, unang-una, napakahalaga, sumunod po tayo lahat sa minimum public health standards. Marami na po tayo nakikita ngayon na hindi sinusuot ang face mask na maayos, ang face shield ay nasa ulo nila at pumupunta sa mga matataong lugar. Lagi po natin tandaan, ang Delta variant po ay highly transmissible. Alam po natin kung ano ang nangyari sa ibang bansa, yung fleeting contacts sa tinatawag lang. Nakasakay lang sandali, nahawa na sila ng Delta variant. So let us be very cautious. Kailangan lagi po tayong aware, kailangan lagi tayong sumusunod sa ating mga protocols. Dapat po manatili po lang tamang tayo, no? Kung sakasakaling maari naman at wala namang essential na gagawin sa labas ng tahanan, manatili muna po tayo sa loob ng tahanan. Kung kinakailangan lang tayong lumabas, tsaka tayo lumabas. Iwasan muna po natin yung mga social gatherings na tinatawag natin, yung mga mini parties natin among our family members, lalong-lalo na kung magkakaiba po ang bubble nyo, wag na muna po natin gawin dahil maaring maging delikado po ito para sa inyo at para sa inyong pamilya. Agad po kayo magpapakonsulta sa ating mga doktor kung makakaranas na po kayo ng mga simptomas related to COVID-19. Napaka-importante po sa atin lahat ngayon na maintindihan na as soon as you experience symptoms or as soon as you know that you were exposed to a positive individual, isolate immediately. Diyan po natin mapuputol ang transmission ng sakit na ito, especially with the Delta variant, dito po sa ating komunidad. Magtulong-tulong po tayong lahat at tayo po sana ay magpabakuna na. Vaccination plus minimum public health standards will always protect us for whatever variants there is in our country. So kailangan lang po magtulong-tulong tayo from the individuals, our families, from the community at pataas po sa local at national governments natin kung sama-sama po natin na gagawin lahat ng kailangan po natin gawin and lalakpasan po natin itong threat ng Delta variant na ito sa ating bansa. So kailangan lang po natin mag-ingat lahat. Tayo po ay sumunod sa mga protocols for health. At pangatlo, napaka-importante, vaccination. Have yourselves vaccinated, get your second dose, be fully vaccinated, and we will be protected from this Delta variant and the other variants of concern. So maraming salamat po sa inyong lahat. Happy Tuesday, and we will see all of you on Friday. Thank you, Lindsay.
Thank you po, Yusek. Thank you to our media partners. For those asking pala, we will just upload the recorded video sa YouTube. Nagkaroon lang po ng technical problem sa Zoom Live. Thank you very much and have a nice day.